Now also making headlines, RSV, COVID, and the flu, a triple threat causing stress and strain to hospitals nationwide. And with the spike in RSV cases among kids under 2, daycares are also feeling the pressure, while schools try to keep up and keep kids safe too. Alex Capriello joins us live with a look at how hospitals are handling the influx of patients. Good morning, Alex.
Mitch, good morning to you. The CDC is reporting 5,000 cases of RSV per week, and relief for hospitals won't be coming anytime soon, with new cases of COVID and the flu spiking right now across the nation.
RSV, flu, and COVID is spreading rapidly, all of which are impacting hospitals and straining staff. Our country is now experiencing a tripledemic, and pediatric units are overwhelmed.
Almost everybody I know now, for example, is sick, and they're sick with one thing or the other.
The Department of Health and Human Services reports 78% of the nation's pediatric beds are full due to an unprecedented number of RSV cases, and hospitals in 7 states are above 90% capacity. The virus that usually causes cold-like symptoms can be serious, especially for infants 6 months and younger and older adults, sending them to the ER. The rise in cases is forcing schools and daycares to be hyper-vigilant, returning to COVID protocols.
This is a UV light that we purchased when COVID started. We put it in all the classrooms, 40 minutes, and it will kill the bacteria and any germs on the surfaces.
Some centers have gone back to taking temps at the door. During COVID, that was a requirement in most states.
COVID cases now averaging 40,000 reported per week, and more than 11,000 people were hospitalized last week with the flu, per the CDC. With this increase in viral illnesses, hospitals in some parts of the country are doing their best to accommodate both pediatric and adult patients.
We're working very hard, and sometimes there's been a little bit delay, and people have to wait in the emergency room a little longer than we would like before they can be admitted.
Medical professionals say the very best way to tackle this tripledemic are to mask up, especially around babies and kids, and get your flu shot and COVID booster.
Now, Mitch, keep in mind some children's hospitals across the nation have called on the Biden administration to declare a national emergency, which would free up bed space and also provide additional resources and funding to other hospitals. Mitch.
Thanks for watching. Go to newsnationnow.com to find NewsNation in your cable lineup. And don't forget to click the red subscribe button below to get more of NewsNation's fact-based, unbiased coverage.